Hello. Thank you for joining us for this special edition episode of Dr. Boz. Today we'll be speaking about MRSA, Methicillin-resistant Staphylococcus aureus. This is a very serious condition in our community today. It affects 2 in 100 people. Today we'll be speaking to twins, Bettina and Brett, who have both been infected with 2 different types of MRSA. Hospital-acquired MRSA and community-acquired MRSA. Let's speak to Bettina first. I'll give a warm welcome to Bettina Billingford.
Hi, thank you, Doctor. It's a pleasure to be here.
Hi, Bettina.
Pleasure.
Please tell our audience your story.
Oh, well, if you don't mind if I do. Well, it was only a couple of years ago when this here thing happened to me. You see, I originally went to the hospital with the case of appendicitis. Well, it all started that way, at least. You see, the nurses kept me in there, and that hospital was awful unsanitary. Those nurses had no real idea what they were doing. Unfortunately for me, they were sticking me with needles that were used back in the 1940s, or so it seemed. They were disgusting. Well, that's how I contracted this here bacterial infection. Well, it ended up giving me some pneumonia. Well, Doc, it gave me pneumonia. That's what I really remember, a little lung restriction. And it gave me these awful bad bumps, these little red lumps all throughout my skin with a lot of pus in it. Well, the doctors came running into my room, awful concerned. I knew something was wrong. Well, what did they do? They cut it open and they took themselves a little sample after draining it. They gave me some vancomycin, and, well, I started feeling a little bit better after that. I don't know, vancomycin is some medication or something to make it feel better and go away over time. But anyway, Doc, I gotta be honest with you. I just don't think that this is acceptable, that hospitals are keeping their patients so susceptible to such awful diseases. I mean, who am I, just a little country girl, trying to go get rid of her appendix, and then I come out of there with MRSA. Hospital MRSA. H-A MRSA. And that is my story, Doctor.
Thank you, Bettina. You are doing the world a service by sharing your story.
You are quite welcome.
MRSA is a highly contagious bacterial infection, and in Bettina's case, it could have been easily prevented if the hospital followed 5 simple rules to stop the spread of MRSA. 1. Always keep a sterile environment. 2. Do not overcrowd the patient. 3. Always keep the environment clean. Clean the bed sheets constantly, clean over all surfaces. Make sure that there's no dirty stuff on there because that could easily infect your patient. 4. Always wash your hands. This is extremely important. Around 20 seconds singing happy birthday, something like that could help you count the time in your head. 5. If your patient has already been infected with MRSA, make sure to put him or her in a quarantined environment and wear protective gear at all times when treating the patient. Welcome back to the special edition episode on MRSA. Only here on Dr. Boz will you see an exclusive preview of how Brett contracted MRSA. Let's watch.
Come on, brother. All right, let's go.
Now, let us welcome Brett, Bettina's twin brother.
Hi, doctor. Good to see you. Good to see you.
Hi, Brett.
How are you?
Please tell us your experiences with community-acquired MRSA.
Well, as you saw in that video, Doc, I was wrestling that boy down at the ground. Well, little did I realize that nobody sanitized the mats prior to me getting on. That is problem numero uno. Second of all, if you noticed, in my singlet, my skin was exposed. Thus, my skin was then touching the mat, which was infected with the bacterial infection known as MRSA. Well, anyway, Doc, I realized post-match that I had this tender, itchy spot right here in my forearm, right next to my brachialis. Well, anyway, Doc, I sat there the next night. After about a day or so, the itching progressed. It got awful and unbearable. Well, what I can tell you about it, I went to the physician pronto. Alright? Doc said, you got MRSA, man. He took a culture. It was cool and all. I thought that it was, that nice oozy goose, but I wasn't vibing. So Doc gave me some medicine, and well, soon enough, I was back on the mat, beating boys up.
Thank you, Brett. You go, man.
Thank you,
That was a
Doc.
great experience for you to come on this show. Thank you for telling all the population about community-acquired MRSA.
You're welcome, Doc.
In Brett's case, MRSA could have been easily prevented if the wrestling mat had been properly sanitized prior to the match. Proper hygiene is also highly recommended. Athletes must always wash their hands and always take a shower. If he or she has experienced any scrapes or bruises, they must be properly cleaned and covered before any activity. If you believe that you've contacted community-acquired MRSA, some symptoms could include red and swollen skin, it could be tender to the touch, it could be full of pus, and you may even have a fever. Do not pop the sore. Cover it with a bandage and call your physician immediately. The physician may be able to simply treat it by draining the abscess. If the infection has gotten too severe, that may no longer be possible. In that case, special antibiotics such as vancomycin or the newly FDA-approved Dalvans will be prescribed, and the infection may take a couple weeks to clear up. Thank you for joining us today on this special edition, Dr. Boz, MRSA.
It's bad.